There's one simple thing you can do right after a meal that can cut your blood sugar spike almost in half. No medicines, no herbs, no expensive supplements involved. Just one small habit after eating. And the effect it has on your blood sugar will genuinely surprise you. Here's the problem though. Most diabetics, somewhere around 90% of them, end up doing the exact opposite of this habit after their meals. And that's precisely why their sugar keeps climbing higher and higher over time, no matter how careful they are with everything else. So let's not waste any time. Let's talk about what this habit actually is, and more importantly, why it works so well. But before we get there, you need to understand what actually happens inside your body in the 60 minutes right after you finish eating. Because once you understand that, you'll realize why this small, almost boring-sounding habit is one of the most powerful tools you have. Now, as a diabetic, you're probably already very careful about what goes on your plate, which vegetables to pick, which flour to use for your rotis, how many rotis you're allowed, which fruits are safe and which ones spike you. This is all good, this is all important. But here's something that very few people actually pay attention to. What you do after you eat matters just as much as what you ate. In some cases, it matters even more. Think about it this way. The moment food enters your stomach and starts breaking down, your blood sugar begins to rise. Doctors have a specific term for this. They call it the postprandial spike, which simply means the sugar spike after a meal. Every single time you eat, this spike happens to some degree, even in people without diabetes. But in diabetics, this spike tends to be sharper, it tends to last longer, and it happens more frequently throughout the day. And here's the part that most people don't fully grasp. It's not just about the number on your glucometer going up temporarily. Every time this spike happens repeatedly, day after day, it's quietly doing damage in the background. Your nerves take damage, your eyes take damage, your kidneys take damage, your heart takes damage. This leads to complications like nerve pain in the feet, vision problems, kidney disease, and heart issues. It's not one big dramatic event, it's thousands of small spikes accumulating over months and years, slowly wearing down your body. So let's actually understand the mechanism behind this spike, because once you see how it works, the solution will make sense. When you eat something like rice, roti, or carbohydrate-rich food, your digestive system breaks it down into glucose. Carbohydrates are long chains of sugar molecules, and your body's job is to break those chains apart during digestion. Once broken down, this glucose doesn't just sit in your stomach. It gets absorbed and enters directly into your bloodstream. And once it's in your blood, that's when your blood sugar level actually starts rising. Typically, blood sugar reaches its highest point, its peak somewhere between 30 to 60 minutes after you've finished eating. This window, this 30 to 60-minute period, is actually the most critical window in the entire digestion process. So what happens in a healthy person, someone without diabetes, during this window? In a healthy body, the pancreas responds to this rising glucose by releasing insulin. Think of insulin as a kind of key. Its job is to unlock your cells and allow glucose to move from your bloodstream into the cells, where it can be used for energy. Once glucose moves into the cells, your blood sugar level naturally comes back down, and everything stays balanced. But in diabetic patients, this entire system is disrupted. The pancreas may simply not be producing enough insulin. Second, and this is extremely common, the cells in your body may have become resistant to insulin. This means even when insulin is knocking on the door, your cells have essentially stopped listening. They don't open up. This condition has a specific name, insulin resistance, and it's one of the core issues at the heart of type 2 diabetes. When your insulin is insufficient or cells aren't responding, glucose that should have moved into cells keeps circulating in your bloodstream. It doesn't have anywhere to go, so it just lingers there. This behaves almost like termites slowly eating away at wood. It damages blood vessels and nerve endings. It puts stress on your kidneys and your heart, all without you feeling it. Is there a way to get that glucose out of your bloodstream and into your cells, even when your system is broken? The answer is yes. We're going to talk about this method and how it produces results that rival medication. Before we get into the actual method, there's one more thing worth understanding, and that's the fact that blood sugar spikes don't happen for the exact same reason in every single person. This is important because it explains why some solutions work brilliantly for one person and barely move the needle for another. For some people, the root cause is insulin resistance, where the cells simply refuse to respond properly to insulin. For others, it might be a diet that's simply too heavy in refined carbohydrates and sugar. For some, stress plays a much bigger role. Chronic stress raises cortisol, and cortisol itself can push blood sugar levels up independent of what you're eating. And for others, genetics plays a significant role, where family history and inherited tendencies make blood sugar control naturally more difficult. This is exactly why a one-size-fits-all approach doesn't always work well for diabetes management. If you want to understand what's actually driving your specific spikes, that's the kind of thing a proper personalized assessment can help with. There's a link in the description for an online health assessment. But for now, let's get back to our main topic, because there's one habit that tends to help almost everyone, regardless of their particular spikes. And that habit is this: a light 10 to 15-minute walk taken right after you finish eating. Now, I know what some of you might be thinking. That's it. That's the big secret. I already walk in the mornings or evenings. Doctor, are you seriously telling me that walking for 10 minutes is going to bring my sugar down in any meaningful way? Fair question. And here's the honest answer. Walking in the morning or evening is good, and none of it should stop. But walking specifically right after a meal is a completely different phenomenon. It's walking timed to intercept the 30 to 60-minute window where blood sugar climbs. When you walk, your leg muscles are working, and working muscles need fuel. That fuel comes directly from the glucose circulating in your bloodstream. Here's the remarkable part. Your muscles can pull in this glucose without needing insulin to unlock the door. This is a completely separate pathway. The exact sugar that your body was struggling to clear can be cleared through this alternate route, simply by moving your muscles. This isn't just theory, there's actual research. In one trial, walking for 10 minutes after a meal led to a measurable reduction in the spike. But there's another study that's even more striking, involving type 2 diabetic patients who were already on insulin therapy. When these patients walked for 15 to 20 minutes after meals, their HbA1c levels improved by roughly the same amount as an additional insulin injection. So this isn't some minor tip. This is a habit with results that go head-to-head with actual medical intervention, and it costs nothing. Of course, there's a catch. This walk needs to be done the right way, and at the right time, for you to get these results. So in the next part, we're going to break down exactly how to do this walk properly, the ideal timing, and the intensity required. Alright, now let's get into the practical details, exactly how you should be doing this walk to get results anywhere close to what those studies showed. Because knowing that walking helps is one thing, but doing it in a way that produces results is a different matter altogether. There's a right way and a wrong way, and the difference can be the difference between noticeable improvement and barely any change at all. Let's start with timing, because this is probably the single most important factor. You want to start walking within 15 minutes of finishing your meal, not 15 minutes after you sit down to eat, 15 minutes after you're actually done eating. Plate cleared, meal finished. Why does this window matter? Because your blood sugar starts climbing toward its peak somewhere between 30 and 60 minutes after a meal. That peak window is when the real damage potential is highest, and it's also when your body needs the most help clearing that glucose out. If you wait too long, if you finish eating and then sit around scrolling your phone for half an hour, you've already missed that critical window. By the time you finally get moving, your sugar may already be near its peak, and you've lost the opportunity to blunt the rise. The point is to have your muscles pulling glucose out before and during that peak, not scrambling to catch up after it's passed. So the sooner you're up and moving after your last bite, the better. Think of it as catching the wave before it crests. Next, let's talk about duration. The minimum you should be aiming for is 10 minutes. That's the baseline to produce a measurable difference. If you can stretch that to 15 minutes, even better. The research actually showed slightly stronger results at that duration. And if you want to walk for 20 minutes or longer, that's fine too. More time moving is never going to hurt you. But the one thing I'll stress, don't go below 10 minutes. A quick 2-minute stroll to the kitchen isn't enough to make a dent. Now let's talk about intensity. Some here walk after eating and think they need a brisk, fast-paced mini-workout. That's not necessary. What you're aiming for is a light, relaxed pace, a casual stroll around your house, neighborhood, or a nearby park. Nice and easy, nothing strenuous. The goal isn't cardiovascular exertion, it's simply getting your leg muscles moving to trigger glucose uptake. In fact, an intense walk right after eating could cause discomfort or digestive issues, so easy and steady really is the way to go. As for when you should do this, ideally, after every single meal, after breakfast, after lunch, and after dinner. But if your schedule only allows this for one meal, make it dinner. The after-dinner walk tends to be the most impactful. After dinner, most of us go straight to the couch, or worse, straight to bed. There's no natural movement built into the evening. That stillness, right when sugar is climbing, makes the post-dinner window particularly risky and particularly worth protecting with a walk. To summarize the 3 rules: start within 15 minutes, walk for at least 10 minutes, and keep the pace light and relaxed. Get these right, and you're replicating conditions that produce results which, in some cases, matched what an extra dose of insulin could do. Think about how doable this is. This isn't asking you to join a gym or carve out an hour for intense exercise. It fits into a life that's already busy, without rearranging your entire schedule. It doesn't require equipment or special clothing. Now that you understand the walk, let's move on to 3 additional small habits to control your blood sugar even more effectively. Now that you understand exactly how to time and perform this post-meal walk, let's talk about 3 additional small habits that work beautifully alongside it. None of these require major lifestyle overhauls. They're small adjustments that, when stacked together, can meaningfully strengthen your overall blood sugar control. The first habit is changing the order in which you eat your food. Most of us grew up eating in a certain sequence without really thinking about it, maybe rice or roti first, alongside everything else. But research has shown that the order in which you eat your food can actually influence how sharply your sugar spikes after a meal. Here's the approach. Eat your vegetables and salad first, then move on to your protein, and save your carbohydrate-heavy foods for last. Why does this matter? When fiber and protein enter your stomach first, they slow down the rate at which your stomach empties into your intestines. This slows down how quickly carbohydrates get absorbed. Protein also triggers hormonal responses that help moderate the speed of glucose absorption. So by the time you get to your rice or roti, your digestive system is already primed to handle those carbohydrates more gradually. The net result is a flatter, more gradual rise in blood sugar after your meal, instead of a sharp spike. It costs you nothing extra, and it takes no additional time. It's just a small adjustment to a habit most of us never think twice about. The second habit is avoiding lying down immediately after eating. You finish your meal, and the natural pull is to go sit on the couch or head straight to bed, especially if you're tired. But lying down right after a meal keeps your blood sugar elevated. When upright, your body is naturally more efficient at processing that incoming glucose. Lying down removes the muscle activity that helps pull glucose out of your bloodstream, allowing that spike to sit at its peak for longer. Second, lying down can contribute to acid reflux. Gravity is no longer working in your favor to keep stomach acid moving in the right direction. So the better sequence is this: finish your meal, go for your 10 to 15-minute walk, and then sit upright for a while. This small sequencing change protects you on 2 fronts at once: better blood sugar control and better digestion. The third habit is avoiding sugary drinks with or immediately after your meals. These drinks add a concentrated dose of sugar directly on top of a blood sugar level that's already rising from the meal itself. If you do want to drink something with your meal, plain water is the safest choice. If you want tea, opt for unsweetened tea. If you really want a sweet drink, the better approach is to wait, ideally at least an hour after your meal, rather than having it immediately. None of these 3 habits are difficult. Changing your eating order takes 0 extra effort. Sitting upright is simply a matter of awareness. What makes these habits powerful is that they work best when combined with each other, and especially with your post-meal walk. In the final part, we'll bring everything together and talk about why this simple combination can genuinely make a measurable difference. So let's bring everything together now, because by this point you have all the pieces you need. You just need to see how they fit into a single, simple routine you can start using from your very next meal. Let's do a quick recap of everything we've covered. Blood sugar spikes happen because of a process your body goes through every time you eat. Carbohydrates break down into glucose. That glucose enters your bloodstream, and your blood sugar climbs, typically peaking somewhere between 30 and 60 minutes after your meal. In a healthy body, insulin steps in during this window and shuttles that glucose into your cells, bringing your blood sugar back down. But in diabetics, this system doesn't work the way it's supposed to either. Not enough insulin is being produced, or your cells are resistant, which means that glucose lingers in your bloodstream far longer than it should, quietly causing damage to your nerves and organs over time. The good news is that there's a completely separate pathway your body can use to clear that glucose, one that doesn't depend on insulin. When your muscles are active, they can pull glucose directly out of your bloodstream on their own, simply through the act of moving. This is exactly why a short walk right after eating is so effective. It's a precisely timed intervention that intercepts your blood sugar. The research we discussed showed that walking for just 10 minutes after a meal clearly reduced the sugar spike compared to sitting still in patients already on insulin. A 15 to 20-minute walk improved their long-term blood sugar control by an amount comparable to an injection. That's an extraordinary result for something that costs nothing, requires no prescription, and takes up a small slice of your day. Remember the 3 rules. Start within 15 minutes of finishing your meal. Don't let too much time pass before you get moving. Walk for at least 10 minutes, with 15 being even better. And don't cut it shorter than that, no matter how tempting it is to sit. Keep the pace light and relaxed. This isn't a workout, it's a gentle stroll, the kind of walking you'd naturally do around your home. Ideally, do this after every meal, but if you can only manage it once, prioritize the walk after dinner, when we're most likely to sit, and layer in the additional habits. Eat your vegetables and protein before your rice or roti to slow down carbohydrate absorption. Avoid lying down immediately after eating. Walk first. Sit for a while, and only then think about resting or heading to bed. Steer clear of sugary drinks with your meals. Plain water or unsweetened tea is safer, and give sweets an hour of distance. None of this requires a diet overhaul or a gym. It's a series of small, deliberate choices layered around meals you are already going to eat. If there's one single takeaway, let it be this: don't sit down after you eat. Get up and walk, even for 10 minutes. This shift has the potential to meaningfully reduce sugar spikes, and over time, that adds up to real improvement in your control. If this video was helpful, please consider liking it. Share it with friends or family members who are dealing with diabetes. And if you'd like to see more, consider subscribing. Drop your questions in the comments. I try to read and respond where I can. Thank you for watching, and I'll see you in the next video. Until then, take care, keep smiling, and keep learning something new every day.